Hello, and welcome to this presentation showing you the use of clinical treatment notes in healthy practice. I'm going to start by showing you the building blocks for these treatment notes. These consist of 4 lists of information and help to provide structure, simplify the entry of text, and enable the use of clinical audit. The good news is that a core set of these lists will already be present in your system, or if not, they can be easily provided to you to get you started. So let's have a look at these lists. From the lookup button on the left toolbar, I can go down to areas, diagnosis and modalities and access each of those 3 respective lists. Areas, diagnoses and modalities. Each of these screens, as you can see, consist of a simple list of information, and entries within each list can be easily changed, deleted or added. You can choose what you'd like in a list at any time and add further entries as required. The final list of information are the blocks of text that once created can be inserted into the notes. These blocks of text are called quick text and are managed via an option under the lookup button. As you can see, each quick text entry consists of a heading, the category to which it relates, and the wording for the quick text itself. So by using quick text, you reduce substantially the amount of typing you need to do, and it helps provide structure and uniformity. There is no limit to the number of quick text entries you can have, and each practitioner can have their own set if desired. Using the change button, existing notes can be easily amended or new ones created. So, I'm now going to enter details for a low back problem for a new patient. With their appointment selected, I click the treatment button over on the left toolbar. This takes me into the clinical notes area of the program, and from here I click the new complaint button over on the left. The first screen enables me to record such information as who referred the patient to the clinic, a basic summary of the nature of the problem, and then I'm presented with separate text boxes as you can see here. And this is where quick text really comes into its own. By clicking the quick text button up on the top right corner of the screen, I can then easily select and drag in to my notes the relevant quick text entry. So now it's simply a case of annotating it based, in this case, on the responses from the patient. Once the information on this screen is complete, I save it. I then continue working my way through the buttons on the left hand side. So the next one is medical history. And note here, I have some separate fields for height, weight, smoking habits, but there's no requirement for you to use those fields. If you prefer to record that information in the general history section, then there is no problem with doing so. Notice also text boxes to record any imaging that's taken place in relation to this complaint and any medication that has been prescribed to the patient. Moving on to examination, I can record details about any chaperone. Again, I use my quick text to bring in my examination for that area of the body. So this gives me all the necessary tests and prompts, and I can simply annotate it with the findings of the examination. Should I wish to make this text appear larger on the screen, particularly useful if you're running this on a tablet, I have magnifying buttons that allow me to do so easily. What's more, if I wish to add a diagram to my examination, I can do so easily by clicking the Diagrams button. And here you'll see on the right hand side, I have a library of diagrams. I can choose a diagram, drag it onto the screen, change the size of it if required, and then I can go to my symbols and use those to annotate the diagram. Now, the library and symbols are simple computer JPEG files, so you can easily add your own diagrams into the library and also your own symbols as well. Coming back to the examination, we can easily add red and yellow flags by clicking the flag button at the top of the screen, putting in the text, and applying the relevant coloured flag. That will now appear at the top of the screen, and I can hover over it to see the text. In addition, beneath the buttons here on the left, I can add a critical note. And using magnifier buttons, I can make it more prominent if required. Moving on to diagnosis, I can easily add a diagnosis from the list that I showed you earlier. And in addition to the primary diagnosis, I can add further secondary and differential diagnoses. Then I can move on to my treatment plan, where I can record my estimated number of treatments. The actual number, the system will track for you and also highlight if the patient has exceeded their estimated number of treatments. Then in the notes field, once again, I make use of my quick text to bring in this case, my treatment plan. It's simple, quick, and easy to do. So that's created the basis of the complaint. Now let me show you how we record each treatment session. First of all, I click my treatments, and this will show me a list of any previous treatments recorded for this complaint. I'm now going to click New Treatment. I can mark the patient's progress since I last saw them. I also have a VAS, so I can mark level of pain, ache, numbness, etc. I have a general area for notes, and yes, you've guessed it, I can easily bring in quick text. And then at the bottom of this screen is where I build my regime of care by adding one or more modalities, again from the list I showed you earlier in this presentation. When I choose a modality from the list, I can then use the dose and detail field to add a bit more information. Each regime of care can consist of any number of modalities. Once saved, if I wish, I can then add a diagram in exactly the same way that I did so for the examination, by dragging the diagram from the library onto the page and then using symbols to mark the areas where I've treated and the techniques that I've used. So that's my first treatment recorded. Each time a patient visits, I would record a new treatment by following those same steps. New treatment, patient's progress, optionally marking the level of pain, entering some notes, making use, of course, of your quick text, add in a regime of care. And then optionally add in a diagram. What's more, you can easily start the process of adding notes for another treatment by viewing a previous treatment and then using the duplicate button here at the bottom of the screen, and that will bring across all aspects of the previous treatment, including the regime of care and any diagrams, and you can just make the necessary changes to the notes accordingly. So, to discharge a patient, I would close the complaint. And when I choose that option, on the closure screen here, I can then mark the final outcome. I can mark the final level of pain, etc. And of course, add any further notes, once again making use of any suitable quick text paragraphs. Details of a complaint can be easily printed by clicking the print button at the bottom of the screen, where I can then select individual sections to be printed. There is also a range of reports available to you, including the ability to conduct a clinical audit and the ability to show a practitioner's work list. What I hope I've demonstrated to you in this presentation is the power, ease of use, and the flexibility of treatment notes in healthy practice. Although the patient data used for this presentation was purely fictional, the building blocks have been kindly donated by existing clinics that use healthy practice in this way, and I'd like to particularly thank both Meta Stoper and Jeff Scher for their contributions to this presentation.